Hello everyone, and welcome to the second part of lesson 8 for the medical care organizations course. Got it. Okay, so for when we last left off, we kind of just went over what was going on with hospitals, inpatient. We looked at a few trends here and there, and we also looked at ways in which we can measure utilization of the hospitals. So now we're on to the second part, and from here on out, it's going to be pretty much just all about learning the different categories of hospitals. Okay, so this might get fun, or maybe not. We'll see. Anyway, so there are several different types of hospitals. There are several different ways we can categorize hospitals, and also every hospital can fit into more than one category. Okay, these are just ways we can, put them in a box or give them a label, but they can go, one hospital can fit into this category, that category, this one over here, and whatnot, okay? So just to let everybody know that there isn't just one spot in which we could put a hospital. Okay, so these are just some major facts that you really need to know, okay, about the categories of hospitals and things like that, okay? So first up, we have the fact that over half of all the hospitals in the United States are nonprofit private hospitals, okay? Private nonprofit hospitals, that means there's it's going to be owned by a nonprofit organization, okay? Private meaning that it's part of the private sector, not the public sector. And remember, I told you guys before that public means government. Okay, so in terms of hospitals, when we say it's a public hospital, that means that it's a government hospital. It doesn't mean that it's open to the public. Okay, it means that it's a government-owned hospital. Okay, anything that's public is government ran, government-owned, things like that. But if it's private, that means it's a private business, okay? It's in the private sector. And given the fact that it's a non-profit private hospital, this just means it's going to be owned by a non-profit organization, okay? Non-profit organizations, the basic idea behind that is that the ownership of that hospital is not really looking to increase the profits of the business so that they can get that huge return on their investment. Okay, that's not happening in a nonprofit organization. The work that you do in a nonprofit organization or a nonprofit business is usually whenever that a nonprofit business will make money, okay, all the profits that the business would come up with, it does not go to investors. Okay, that's not the point. That money is going to go to fulfill some mission of this nonprofit organization. So maybe they like to donate all that money to some charity. Maybe they're working on some project to help the community or something like that. Okay, so nonprofit organizations do not collect profits. They don't try to get their return on the investment. Private for-profit businesses, yes. They're going to have investors. They're going to be trying to get as much profit as they can out of the business because they want that return on their investment. Okay, just to let you guys know, that's the difference between nonprofit and then for-profit, and then of course public, which is government. Okay, so anyway, back to this. Private nonprofit businesses or private nonprofit hospitals, another term for that would be voluntary. So voluntary hospitals would be private nonprofit. Okay. All right. So then we have state and local government owned hospitals or public, right? Those are the second largest group of hospitals in the United States. Okay. Then we have for-profit hospitals, the for-profit investor-owned hospitals, and that's third highest in the United States. Okay. Then we have federal hospitals, which are public. Okay, this is owned by the federal government. And these are fewest in number. So these are the least amount of hospitals that we have in this country. Are the least amount of hospitals, or at least the group of hospitals, are federally owned by the federal government, owned and ran by the federal government. Okay, so there are so many different ways we can classify hospitals, and they are not mutually exclusive. Like I said, any hospital can fit into several different categories. So let's move on. So the first way that we're going to learn how to categorize or classify a hospital is through ownership. Okay, so there are 3 different ways that a hospital can be owned. All right, so first we got public ownership or government ownership. Okay, public means government, so government ownership, that's like the first one. Okay, and then we have private nonprofit, remember, and then another word for this was voluntary. So let me just put that in there. And then we have private for-profit or proprietary hospitals. These are the ones that are investor-owned, or maybe a group of physicians own this, and they're trying to get the return on their investment with this business. Okay. Moving forward. So public hospitals, remember, government hospitals. Okay, public is government. It doesn't mean it's open to the public. So don't think that it is. I mean, don't get me wrong, a lot of public hospitals, probably most of them, are open to the public, but it's because of the next way that we can categorize them, because we're going to learn how to categorize them into who's allowed to go into the hospital, who's not allowed to use the hospital. So that's going to be another way we can classify them, but just classifying them based on who owns it. Public is government. Okay, that's what public means. So it can be owned at 3 different levels if it's a public hospital. Okay, so it can be owned at the local level, it can be owned at the state level, and then also the federal. Okay, federal hospitals. So if it's owned at the local level, like it's going to be owned by the county or like the city, the town, and usually locally owned hospitals like that are going to serve the more disadvantaged. Okay, they're usually they're smaller hospitals. Okay, it doesn't necessarily mean that they are all small. Some are very large and huge, and they're a big deal. But many of the locally owned public hospitals are going to be smaller, and they're general hospitals. Okay, and they're open to the public, and they mostly serve those who are more economically disadvantaged in that area. And then the state-owned hospitals, okay, so the ones that are owned by the state, not necessarily the little locally owned cities, those who are owned by the state are mainly psychiatric hospitals, okay? So they're mostly psychiatric hospitals. Now, federal hospitals, these are owned by the federal government, okay? And the tricky thing about the federal hospitals is they are not open to the public. Okay, there are very few of them, and they're only there for special populations, special groups. Okay, so some special groups that have federal hospitals that are open to those groups would be the Native Americans. And then we have, our armed forces. So the military uses, or they have their own system, and of course that's going to be federally owned and ran, and it's the TRICARE system. Okay, so armed forces, they get TRICARE, and that's all federal owned hospitals and federally ran. Okay, and then same thing with veterans, they have the VA system, right? The VA. Okay, and then we have other special groups, special populations that, small groups where the federal government owns their hospitals and it's regulated by the federal government and paid for and all that. So anything federally owned, any kind of hospital facility that is owned by the federal government is not open to regular citizens. Okay, I don't know about you guys, but unless you fit into any of these special groups, you're not allowed to use those hospitals. Okay, they're not going to treat you there. You go to the regular ones, the civilian ones. Okay, like I know I can't use those hospitals. So anyway, one cool trend that I want you guys to look at about the federal hospitals is that they actually experience a really high length of stay, average length of stay in their hospitals. So I want you guys to sit there and ponder on some reasons for why that might be. Why do you think a federal owned hospital might have a much longer length of stay for their patients than just regular hospitals? Okay, and think about this. Federal hospitals they're federally owned, okay? They're government owned. They're not out there looking for a profit, right? They're not trying to make money off of everyone, because everyone that's using their hospital is, it's being paid for by the federal government anyway, okay? So the federal government has their own special health insurance for the Native Americans and their own special health insurance for those who are part of the TRICARE system or the VA system. Okay, so that is what pays for their health care in their federally owned hospitals. So these federally owned hospitals are not out there trying to, get other patients in and try to make profit off of them. It's just completely funded and ran by the federal government. So there's really no incentive to, to try to get people in and out and, to move. There's no sense of urgency. We don't have to keep turning over patients, okay? So think about that a little bit. Compare that to what a private sector hospital would be like, because we've all been in a private sector hospital, right? I don't think there's anyone here who hasn't had any hospital experience at all, even with a family member. You've been inside of a hospital at some point in your life, probably. So these hospitals, like community hospitals and whatnot, usually they're more fast-paced, right? Aren't they just kind of running around? If you're in the ER, you probably saw a lot of chaos, and so in hospitals, they try to get people in and out as fast as they can. It might not seem like it because there's always a long wait time, but at the same time, if you look at the staff, they're usually moving and they're usually stressed. Okay, but if you ever went to like a VA hospital, it's actually very chill. Okay, there isn't too much of a sense of urgency or anything like that, and it's kind of like that in the government when you work in government, especially for the federal government. So anyway, something to think about. Let's move on. All right, so now we're looking at private nonprofit hospitals. We'll just go through this really quickly. Remember, this is the largest amount of hospitals, and like most of the hospitals in the United States are going to be private nonprofit hospitals. Okay, So they're usually operated by community associations, just non-government organizations, nonprofit organizations. And normally they'll have a mission to benefit the community with some project or whatever profits that they come up with in this hospital. They do something for the community. That's the whole point of a nonprofit, especially a nonprofit hospital. So, all right. So here we go. Private for-profit hospitals. These are the ones that are owned by maybe physicians or the other investors and whatnot. Okay, so these type of hospitals, this is the so these type of hospitals, they're definitely looking for a return on their investment, and so they are trying to increase profits all the time. Okay, with these hospitals, it doesn't make them bad, but I mean, because if you compare them to nonprofit hospitals, they still have that same sense of urgency. They're still trying to turn over their patients quickly, and to still have that incentive. They still kind of run the same. They're still very competitive as well. It's not just because it's a nonprofit, it's not going to compete. They compete fiercely in the market. However, they are trying to generate profit really from their patients and whatnot. But the thing is, it's what they do with the profit, and where the difference is. See, in a for-profit hospital, this is where the investors want that profit back. Like, this was the whole point of investing, so that they can get more money. They can get their money back and then some. Okay, and for a nonprofit hospital, it's just they want that extra money so that they can put that towards their mission in the community. Okay. All right, so the next way that we classify hospitals, okay, are going to be based on public access. So that means, do you allow the general public to utilize your facility, or do you not? Okay, there's only two options when we classify hospitals based on public access. Okay, so those that are non-community hospitals, meaning they do not allow the general public to receive services from these hospitals, those would be federal hospitals, which we've already talked about. Federal hospitals are not community hospitals. They do not allow the general public in there, okay, receiving services. But there are other facilities that are also non-community hospitals. So some of those might be hospital units of private institutions, so like private colleges and private prisons and things like that. They're not going to allow the general public to use their healthcare facilities. It's just for their students or their inmates and whatnot. Okay, so also long-stay hospitals, and we'll look at what long-stay hospitals are in a couple slides. But the general idea behind long-stay hospitals are where you stay in the hospital for more than 25 days. Okay, so you have a condition that requires you to stay in a hospital for more than 25 days. All right, and of course, in order to even have a condition or a reason to stay in that hospital, you must have had like a referral or you were in a regular hospital and then they transferred you over to a long-stay hospital because that's what you require. Now, long-stay hospitals are not going to be hospitals where just the general public can just check themselves into a nice old long-stay hospital and expect to just stay there like it's a hotel or something. So that's pretty much the deal. Long-stay hospitals are going to be exclusive, and they are going to be for the people who need to stay in a hospital for more than 25 days. Okay, so another way that we classify hospitals is based on their unit affiliation. Okay, so we can have, so some hospitals are just single units, just a single unit hospital. It's just one hospital. Okay, it doesn't have it's not like a chain. And then other hospitals, they are a chain. They are multi-unit affiliation. So that's where there's maybe St. Mary Medical Center. There's a bunch of St. Mary Medical Centers. They're all connected. Okay, so or like with Prime Healthcare, they own a lot of hospitals over all over the country. And so they would be a multi-unit affiliation. Okay, so they have multi-hospital units all over the country, and it's all owned by the same corporation. Okay, so two different ways: single unit, multi-unit. Okay. All right, so now we can classify hospitals based on the type of service that they provide. Okay. So are you a general hospital? I think we all know what a general hospital is. It's just generally everything, kind of. So gigantic hospitals can be general hospitals. Small hospitals can be general hospitals. A general hospital can be, they're usually always community hospitals. But they can also be non-community hospitals, because many federal hospitals or maybe Native American hospitals are general hospitals. Okay, so just because it's a general hospital doesn't necessarily mean it's always going to be open to the public, but most of them are, because most of the hospitals in the United States are general hospitals. Okay, so then we have specialty hospitals. So there are specialty hospitals out there. There are cardiology hospitals, respiratory care hospitals, all, such and such. Okay. Then there are psychiatric hospitals, and we already kind of went over that before, that those are mostly state-owned. Okay. And then rehabilitation hospitals, there are or there have been in the past. However, these days, rehabilitation hospitals are kind of going extinct. Actually, so they're now we mostly, general hospitals usually have a rehabilitation unit in that hospital. So there aren't many exclusively rehabilitation hospitals out there. There are, but they're not very many. We usually use general hospitals, and they have a rehab unit in their hospital. Children's hospital, children's stuff, kind of like a general hospital. And okay, so we just went over general hospitals. So you can go ahead and relook at this if you feel like you need to, but we're gonna move forward. Okay, same thing with specialty hospitals. All right. All right, psychiatric hospitals. I think we already touched on this one. Let's move forward. Rehabilitation hospitals, like I said, a lot of them are going extinct anyway, so for the most part, many general hospitals have their own rehabilitation units. So 80%, there we go, are hospital-based units rather than freestanding hospitals. Then we touched on children's hospitals already. Okay, so another way that we can classify hospitals can be based on length of stay. Okay, so that means how long are they staying in these hospitals? Most of the hospitals in this country are going to be short stay hospitals. Those are your common everyday hospitals, your general hospitals and whatnot. Those are all just short stay hospitals. Same thing with the specialty hospitals. Most of them are short stay hospitals. Okay, so short stay hospital is where you stay 25 days or less. Okay, next are the long stay hospitals. So these are the ones where you stay over 25 days. So the type of care that's usually given here, remember I said, you know, a lot earlier, chronic care is that long staying, almost, you know, it's gonna probably stay with you for the rest of your life type of an illness. And chronic care, typically that's a lot of that is, even if it's intensive chronic care, that's gonna be something that's gonna be with you for a long duration, a really long amount of time. So that, along with many long-term care services and psychiatric services, can all be done in a long stay hospital where you're going to stay there and be cared for over 25 days. Okay. Remember, chronic care is long-lasting. Acute conditions are more episodic. So they're short-lived. You have your episode, and then you get treated, and then you're no longer you no longer have an acute condition. Okay, so acute conditions are treated in short stay hospitals, and then those you can receive like intensive long chronic care in a long stay hospital, because you're going to be staying for a long, a really long time. Chronic care lasts a long time. Okay, so then we have long-term care hospitals. Okay, so long-term care hospitals will be like your skilled nursing facilities and whatnot. So these are those hospitals where they have more intensive care 24/7, like the patient's gonna have 24/7 care. Okay, and a lot of these are gonna be many seniors actually are staying in long-term care hospitals, and actually a lot of other people who have other conditions, but usually when we think of like skilled nursing facilities or even like all of that, we usually think about the older adults having to live in a skilled nursing facility because they've gotten to the point where they can no longer take care of themselves. Okay, so, and if it's that type of facility, it will have to meet Medicare's guidelines, okay, so that they can be certified in order to accept Medicare. All right, let's move forward. Skip that. All right, so then we can classify hospitals based on location. Okay, so we got urban hospitals and then rural hospitals. Urban hospitals are the hospitals that are in urban areas, or those highly populated metropolitan areas. Okay, a lot of people. All right, higher populated areas. And then your rural hospitals are those hospitals that are in the rural areas. Okay, the not so populated areas, those small towns and farm areas and things like that. A lot of that is gathered in the middle of the country, but we have a lot of rural area here in California as well. All right, let's move. Okay, so now we're going to look at sling beds for rural hospitals. So remember, we've touched on this before. I know we definitely learned that rural hospitals suffer, okay, business-wise. They have a really hard time staying afloat and staying in business, and a lot of that is because, well, first of all, in the rural areas, they don't have as many people, okay? There are less populated as, you know, we are over here. So lesser populated areas are going to get lesser patients, right? And then, well, the money's coming from the patients. And we have lesser patients, then we're just not going to be making as much money, right? Also, even more so than that, the physicians that these hospitals require or that are needed to care for the patients, they're expensive. Okay, so hospitals are having a really difficult time paying for the resources, the physicians, and whatnot, and on top of that, they're not getting as much, you know, business. They're not getting as much money. So what the government allowed for was they allowed them to do this whole swing bed thing, okay, swing bed concept. And what this meant is that there are certain beds in the hospital that will be allowed to use for different things. Okay, so you can use up to a certain amount of beds, right, in your hospital, and those beds can be used for acute care stuff, right? Your you know, patching up wounds and I don't know, surgery stuff, whatever. They can also be used for skilled nursing care as well. So many of the that's a lot of that's for chronic care as well, right? So you can use this for acute or chronic care. They're allowing these hospitals to use these beds for multiple uses, basically. Okay, so both sides they can use these beds with, and that helps out so much because now they don't have to have, you know, all these different sections or units at their hospital. They can just use that one section with all those beds, and they can use those beds. So that way they will be able to save on a lot of other resources, especially when they're not getting as many patients. Okay, so they can start condensing their resources and just using those beds. So it's a pretty cool strategy that they were allowed to do. Of course, only those hospitals are allowed to use them, and they do have to pass certain criteria. Okay. All right, so in 1997, the federal government issued this Balanced Budget Act for the hospitals, or the rural hospitals, okay? So they allowed them to use the whole swing bed concept for a max of 25 beds, right? And then there are several other things that they allowed for the rural hospitals. And one really cool thing that I want you guys to take note of, and I know I'm kind of like blocking it, but it's the last bullet point down here on this slide where it says cost plus reimbursement, not to exceed 101% of the cost. So what that is that the government allowed these rural hospitals, okay, to switch back and go use the old cost plus reimbursement system that they had before prospective. Because remember that whole shift going from cost plus to the prospective payment system, that caused so many hospitals to like go out of business because now they couldn't make as much money from Medicare. Well, the government understood that certain hospitals struggled a whole lot more, and they didn't have very many choices. See, a lot of the hospitals in the urban areas, the more highly populated areas, they were able to switching to or focusing a lot on like their outpatient units actually benefited them, and that strategy worked really well for them because they had plenty of patients. That having patients wasn't their problem. Okay, so they could easily get the patients. They just were having a hard time paying for everything that the patients needed. But if you move them all to outpatient, then that works. that worked for them. They were able to make money and still care for their patients, and they had enough patients. However, the rural hospitals, they suffered because they couldn't even they can't afford to focus on outpatient because they're not even getting patients. They don't have enough patients to even build capital to develop their outpatient units. So this helped tremendously when the government said, you know what, you guys go ahead and switch back to the cost plus reimbursement. We understand. We need you to stay open so you do not have to use the new prospective payment system. Just go back to the old one. And it helped them so much. Okay. Now looking at how we can classify hospitals by size. Really, there's no like actual standard with classifying hospitals by size. Okay, so what people usually do, or what you're gonna hear a lot when you get out there and start working in healthcare, is you're not necessarily gonna hear like big hospital, small hospital, or anything like that. Not medium or regular, venti, grande, anything like that. No sizes, no size classification. But what we do hear a lot is when people want to talk about the size of their hospital, they'll talk about how many beds they have. Okay, so I'm just going to put that right here. Just say hospitals talk about the size by talking about how many beds that they have. Okay, so you'll hear people going like, oh yeah, I'm in charge of that hospital over there. It is a 350 bed hospital. Or that hospital over there that he works at, that 150 bed hospital. Yeah, that one. So you'll hear that kind of stuff going around there. When we talk about size, it's usually just how many beds. People don't really go large, small, big, medium, or anything like that. Okay, so teaching hospitals. Teaching hospitals, that's another way we can classify hospitals, teaching hospitals and hospitals that also don't teach. Okay, teaching hospitals, we should all know what a teaching hospital is. Okay, it's an academic medical center. Teaching hospitals are organized around medical schools. Okay, and the teaching hospitals they're very research and clinical investigation like oriented. They live for that, and they also have the best technology, or the latest medical technology. They have teachers and whatnot that are like their whole objective in life is to work on clinical investigations, like all these mysteries in the human body. They really like to zoom in and focus on that and figure stuff out. So that's usually what's going on at teaching hospitals, and they're usually huge hospitals. Okay. Moving forward, then we have church-affiliated hospitals. I think a lot of us are familiar with church-affiliated hospitals. It doesn't have to necessarily be, a church, like a specific religion. It's usually just a religious group. Okay. It doesn't have to be, it doesn't have to be just Christianity related. Okay, that specific religion. There are, Jewish hospitals, and I know of a Muslim free clinic as well. So, there are other religion affiliated medical centers and hospitals and facilities like that. But usually when we're dealing with a hospital that is some sort of religion affiliated, they will typically usually it's like the facilities, their mission, their values, their mission statement, the goals, their policies, how they run the business, it's all derived from the religion. Okay, so and many hospitals will say, like a lot of Catholic hospitals, they will not allow certain practices to happen, okay, in their private hospital. Okay, like for example, many times when women will give birth, and let's say that is their last child, they do not want any more kids, they want to get their tubes tied. If you just give birth at a Catholic hospital, they're not going to allow you to do that. Now, it doesn't mean you can never do that. You just can't do that at their hospital. You can actually go get it done in another hospital that allows that, but just there, okay? So they usually have their own policies and things like that that you have to abide by, but, it's cool. So next we're going to look at osteopathic hospitals, so whether it's an osteopathic hospital or not. And I mentioned this before, I know, that these hospitals they're also going extinct. There are very few left, but these are the hospitals that the osteopaths, or the osteopathic physicians, the people that receive the DO degree, these are those hospitals. Okay, so they practice medicine they practice allopathic medicine. They also practice alternative medicine, and so those hospitals were focused on those values. Okay, the osteopathic philosophy of medicine, but many of them are closed now. So moving on, now let's look at licensure, certification, and accreditation. So the best, what you really need to know about this really is that if you're a hospital, you have to be licensed. Okay, to operate, you have to be licensed. So you will have to get licensed by the state. Licensure is required, okay, in order for you to be a hospital. Required, let's put that here. Required to operate, you have to have a license, okay, for a hospital. Now, let's go to certification. Who thinks we have to be certified in order to operate as a hospital? Raise your hand. I'll wait. Okay, fine, I don't want to waste your time. No, you do not have to be, you do not have to get certified to operate, okay? So it's totally fine. Really what certification does, it allows you to accept Medicare and Medicaid. So if you wish to accept Medicare and Medicaid in your facility, you want to accept those insurances so that you can see those patients, then yes, you got to get certified. But in order to operate, it's not necessary. And how do you know if you even want to accept Medicare or Medicaid in your facility? You probably want to look at the demographics of all the people who live around you. So if it looks like most of the people who live around you are probably Medicare beneficiaries, then yeah, you're probably going to want to be certified. But if it looks like most of the people around you do not use any kind of public insurance, and it looks like everyone is a private insurance person, then maybe you don't even want to bother getting certified. You don't have to. It's not mandatory. You can still operate without Medicare and Medicaid certification. But if you want to accept that reimbursement and you want to care for those patients, you got to get certified. So that's the deal there. Next, we're going to look at accreditation. And accreditation is not required. You don't have to be accredited as a hospital, but it's really good for your status. Okay, so it's great for your status among all the hospitals. if people understand accreditation, and you know, a lot of people out there do, and they actually look at that just to make sure that you are a good standing hospital, you're going to provide excellent, you know, quality care for that patient, then people are more likely to go there. Okay, so that's really all accreditation is. It's you can think of it more as like, if you care about your reputation and you care about your brand, that's what accreditation is good for. Okay, but you don't need it to operate. Okay. All right, well, that is the very end of this whole lesson 8. All right, so I will see you guys in lesson 9, but if you guys have any questions about this, you can drop a comment, email me, whatever. Okay, see you then.